My name is Nara Murillo. I'm the host of Agewell Avenue podcast, and my co-host is Barbara Slingloff.
On this show, we talk about navigating healthcare, housing, investing, and advocating for our seniors.
So as I continue talking about, I guess myself and what really drives me as I kind of ended my career and what I'm doing at the moment, I wanted to go into more of my interests and what really drives me. Um, I think that I believe I believe that we all have a purpose, and as I was kind of going through this career change for myself and realizing that I really wanted to impact people's lives and realized what my purpose was, um, it's really about just making a difference for me, really, and impacting in a bigger way. And I think I've kind of mentioned it in a few of the other episodes as well. But I think that one of the things that I want to um, impact is obviously, as I've been saying, the senior community. And, I feel like this area for the seniors, or even at the moment, I should say, that it's just there's so much need for these seniors, right? So I feel like they are just in need of resources. They're in need of education as to how to navigate healthcare these days because it's just has gotten so complicated, right? And I think a lot of this is very simple. And I feel like, being in so many different organizations and just being involved and listening to all of these different things that are happening these days with these huge organizations that are doing all these trials and they're testing out all these things. I hear that, as far as case management is concerned, they're trying to, in order to prevent, because I think right now the biggest problem that we're having in the space, in the senior space, is that everybody is feeling the readmission rates, right? Which basically means that a lot of these seniors are coming back to the ER. And I think to me, it's just a simple thing. I just don't understand why it has to be so much more. I feel like as human beings, we make things more complicated than they need to be. And it's very simple. I think that, you know, we try to throw ton of resources at these seniors. We try to automate things. There is automation to everything. And now with AI being involved, and, what we're missing is no matter how advanced we get in AI, regardless of what this looks like, ultimately, these seniors are human beings. And we are very unique and different in so many ways, from robots to humans. And I would think that people at these upper management and the levels, and the CEOs and the VPs, and whatever you want to call it, all the top people that are making these decisions, it's just mind-boggling to me to kind of see all these educated people can't even comprehend one thing. And it's these people need human touch. These people need education. They come from a different world. At the time, it was very different. Back in the days when they were growing up, and things were very different, and it's very different now. So I think that in this era, we have forgotten that these seniors are elderly. And so they're used to a certain type of interaction, and we're completely missing that. So I think to me, it's just, that's what I want to be able to do. I want to be able to be that gap between the actual senior and whatever the next level of care is going to be for them, right? Whether it's going to the hospital, why should I be going to the hospital? Or do I have other resources that I can, utilize? And how do I prevent myself getting to that point, right? So it's just so many different things that we can educate our seniors on and assist them and help them navigate through this, that we're completely missing that. And that's what I want to be able to do in my 16 years of doing this. It's over and over. I see this, and I have probably seen more trials and more pilots and more. I don't know what else I can tell you that they come up with to try to solve this issue. And it just has not been solved because we're not going to the root issue of why are they coming to the ER? Just because you're throwing resources at them, it does not mean that that's fixing their problem, right? Whatever that is. So I think that we are in a hurry all the time. We are in rush. We are onto the next thing, onto the next thing, but we don't stop and just say, let me hear these people out. Let me see what problems they're having. Today you go into a doctor, and let's be honest, primary care doctors who have 500 patients assigned to them, I'm sorry, but they're not going to remember who you are and what your history is. You're just a number. Unfortunately, it's unfortunate to say, but that is the reality of healthcare these days. And so I think that that's what I want to be able to bring to the senior community is not only the education of how to, you know, um, be able to utilize their healthcare, but also what is provide them with resources that connect them with different types of programs, things that they can, whether it's healthcare or whether it's social, whether it could be housing, it could be meals, whatever that is, right? Durable medical equipment. Just how to navigate it, right? I mean, let's be honest, these days, seniors don't even know what they're signing up for. A lot of times, and I'll be, going more in depth into this, but they don't even know what kind of insurance they have and what their coverages are, right? And so I think that that's what we want to be helping these senior communities and being that partner with them to be able to um, help them navigate and educate and whatever that we're missing that's needing to happen right now. And ultimately, even though every one of us, right, as case managers, these organizations have case management departments. But let's be honest, we have 120 patients on an outpatient basis. For us to be able to manage 120 patients, and majority of it is done telephonically these days, between COVID and everything else that has happened, no one is going and seeing. I mean, I remember back in the days, I would actually go meet them at their doctor's appointments and help them understand what's going on with them, and also assist them in when they were in the hospital. I would go see them in the hospital. We don't have those things anymore from case management perspective because of all these different, interactions, and these people are needing that, whether we like it or not, right? Ultimately. So I think for me is just, being able to provide them with all of those resources, housing, education, and whatever we can. I mean, if it's home health related, if it's skilled nursing facilities related, if they don't know who to go to, and a lot of them are just relying on whatever that their physician says. If their physician is saying, "Hey, go use this home health agency," um, because a lot of times we all know, right? Some of these physicians actually are, owning a lot of these home health agencies, or, and it doesn't necessarily means I know that there's rules and laws of, how much of your patients you can send to your own um, agency. But ultimately, it comes down to every Medicare patient needs to have an option. You can give them options and say, this is what I've always done. That I've always given my patients options. I would say, this is who I normally use, and this is, if your physician's recommending one, have you had any experiences with these types of agencies? I always educated them. And for whatever reason, they would always just kind of trust me, because I would, you usually use agencies that my patients were happy with. And I knew, I set the standard very high when I'm using a lot of these agencies. And of course, I don't have any affiliation. I don't own any of them. So to me, it's a lot of them are just getting feedback from my patients and saying, they were great. They did X, Y, and Z. And I always look for agencies that go that extra mile for them to be able to, provide that extra care, whatever that is, right? So I think that I compare, as to what services they offer in comparison to some go just a little bit more, just like hospice agencies. When you're dealing with a hospice agency that's really big, right? And the smaller agencies don't offer as much as the bigger agencies, because obviously, from a financial perspective, the bigger agencies have more of that, the ability, right, to be able to offer more. And so, but it really just depends on what you're really looking for. And that's the reason why I always talk to my patients and make sure what is their need. I will always give them at least three options for them to speak to all of these different agencies and for them to make the decision as to who they're going to be going with. And so moving forward, that is my goal, is for me to be able to work with specific agencies that are doing this type of work and that are able to go that extra mile, that have that credibility. And I know that I can trust them with my patients. And so that is huge for me. And so those are some of the things that I want to be able to offer them. But not only that, also, going into skilled nursing facilities, right? And so, we're going into housing now. It's very, very, I want to be able to not only provide them with housing. A lot of these seniors are on a limited budget. And so they're only able to afford, you know, so much money monthly that they can pay for rent. And so those are some of the things that I want to be able to provide. And the ability of possibly in down the road, owning a property that I can actually help them and place them in those properties if they're independent, obviously. And if they're not independent and they're needing additional, whether it's skilled nursing facility and applying for Medi-Cal, or because obviously, and of course I'll get into a lot of this more in other episodes, but just so that you have an understanding and a vision of what my goal is and what I'm trying to accomplish and what my vision is and my interests and what I'm trying to accomplish ultimately. It's just that understanding that, when you come to me, it's just going to be that you're going to get the best care, the best, whether it's agencies, whether it's facilities, whatever that is going to be, I'm going to make sure they're all, all of them are checked, making sure that they are, guaranteeing certain things. And so making sure that, and if there's any type of complaint or anything that I get from, my patients that I send to any of these facilities. And a lot of them, I mean, of course, are going to be facilities that I'm already working with, that I already have, established relationships with. And if it's a new one, it's definitely going to be tested out and making sure that they are up to par and they are, who they say they are, and they are actually producing what they're saying they're going to produce. And if not, that's totally okay. I will not ever work with them again, and that's okay, because that's my number one priority is my patient and making sure that they're getting the care that they need. And The other thing is obviously, as I, a lot of this I'm talking about more so, going into the nonprofit, as I touched base on that on the last episode a little bit. But this is really going to be what the nonprofit is going to be offering. And so, on top of that, really having, creating jobs, being able to provide, people that really have passion for this and have passion for people and helping seniors. It's really going to have to be, not only just, having to be, aspire to be a great leader, but also, uh, just, it's almost like I talked about, right? Like passing the baton and making sure that these people are wanting to do this, and making sure that these people are absolutely, 100% heart in, wanting to make a difference, wanting to continue this, and making sure that there's more of us that are really caring, and being creative and coming up with different ways and different things and different resources, and how we can offer more to our senior community and help them age better and not so much stress. I mean, I can't tell you that I see so many seniors these days that are just suffering in health, and suffering in just where they are, right, as far as housing goes, and financially, and they're not able to afford medication. Those are some of the things, depending on what type of medication. There's also a lot of resources with the drug companies that we can, basically close that loop, close that gap. So there's just so many resources out there that we really can tap into. And I think people just don't know. They just don't have a clue about, where to start and where to end. And like I said, again, right, as healthcare professionals, we are so overwhelmed. And as I was mentioning, as an outpatient case manager, I had 120 patients. There's no way that you can manage 120 patients the right way, plus triage them, plus create short-term, long-term goals for them, making sure that you're speaking to them. Every patient has a different need. You can be with one patient on the phone for 30 minutes, every other day, sometimes daily, depending on what they have going on and what type of coordination of care they're needing. If they have procedures, or if they're having some sort of crisis, or depending on their condition. It's just so much that is out there that it's kind of impossible to be able to manage the right way, right? We really have to focus on, which I've said this from back then when I was managing these patients, it's really about, do we want quality or do we want quantity? If we're just going to be overloading these case managers with so many patients, we cannot ask for the outcomes that we're requiring from these case managers, right? So now we're doing all these different, programs where one person is trying to juggle and manage, whether it's inpatient, whether it's outpatient case management or skilled nursing facility. All these roles are different roles, and they have different responsibilities and a different knowledge. One nurse is not going to be able to be good at all of it. There's just no way. And there's just so much time that we lose because the brain is only adjusting to each role, for a certain amount of time. And every time you change that role, that nurse has to adjust, the brain has to adjust to whatever the next task is that has a completely different responsibility. So to me, I don't see that working. And only because I've done it and I know what it takes. And I'm speaking for not so much of, let's just give it a shot and see if it works, but I know it doesn't because I've done it. And so I think that those are some of the things that, you see and you just are mind boggled, and you're thinking, why can't I create something that I know works, that I can impact and actually help these, not only the prevention of, I mean, I'm sorry, but what senior wants to go and sit in the ER or call 911 and be in the hospital for days on out while they're running every test that they could possibly be at the hospital? And when there's just so much in the hospital that it's not even good for these people just to be going and just sitting there for days on out because they have to be, going through all these tests. Why couldn't we have done that as an outpatient? And if there was a problem, this obviously stemmed from something, right? So instead of waiting, because we have an access issue these days, right? Of a lot of our providers, specialists especially, we're not able to see them within the right amount of time, right? So we have, at least 2, 3 months out in order for us to see an endocrinologist or a neurologist or dermatologist or podiatrist, whatever the specialty is, cardiologist, nephrologist, it's rheumatology. I mean, they all have some sort of wait time. There's no way that your problem arises. And with these seniors, a lot of times it just all of a sudden comes up, right? They cannot wait for 2, 3 months for them to be able to resolve this issue, right? And everything else is, just a domino effect after that. So I think it's really about kind of, reassessing all of this and looking at from just a basic point of view. And we can also impact in such a bigger way if we just took the time to do it on the front end and not try to, while the patient is in the emergency room at this point, we're throwing every type of resource out there at them to say, okay, let's get you, to A, B, and C, let's get all these things for you and solve your issue, where we could have done it as an outpatient, right? And so had enough people to be able to do this as an outpatient. So I think that, and if you all have any type of question or anything, I would love to hear from you. I think that, the links are at the bottom of this video. If not, you can always just leave a comment. You can also reach out to me on social media. I'm on Instagram, I'm on Facebook. If you have additional questions, if you need any type of additional explanation of anything, if some of what I'm using, some of the words is new to you, I would love to break that down for you. Just let me know. I'm sure that probably I will at some point in one of the episodes. But this is really my goal of not only helping these seniors, but also before these seniors are there, prior to getting there, equip them better, right? To understand these are some of the choices, these are some of the options you have, and also giving them an opportunity to not only get ready for retirement, but give them an opportunity to be able to save more on their retirement and have, options that they have that they can invest in things that, can even grow their retirement, right? So educating them on a lot of these different things and what their options are. And so I think that's really my goal, to really help them retire, have a better retirement, have a different, better health. And so just understanding all of these things. And unfortunately, a lot of the times it's really difficult being one person to be helping a mass number of people. So for me to really be able to do this, I really had to kind of do it in this arena of, whether it was the podcast, whether it's the nonprofit, it's just things that is helpful and that are going to impact in a bigger way, that I'm able to impact many more people instead of just one or two that I can impact, right? So I think those are some of the things that my vision and my purpose, and where I'm headed with all of this. And also just, being a good leader. Of course, I've talked about this before, and I am, and of course you're going to have people that are not going to be what they're not going to like your style of leadership. But I think that in my time of interviews and going through, different hiring processes and, just all of that, going through all the different leaders I've had, I think that choosing the right people to be part of this are most of the time they're going to be liking and wanting to make an impact and do this with us. And I'm almost positive that they're going to enjoy the process because I'm going to make sure that I am that leader that is there for them, that is providing them what they're needing and educating them along the way of what they need to learn and what they need to know. And, really to kind of, I'm not going to be doing this forever. So just for them to be able to take this on and continue whatever Barbara and I start. And I know Barbara hasn't been in some few of the episodes. She was on vacation, and she has some things that she had to take care of also for her parents, and she has parents who are seniors, and so she's been busy with them. And I think that, of course, being that we're in the space, absolutely, we are their advocate, and no matter what, whether they're family or why I'm doing this is to be their partner, to advocate for them, to make sure that they're getting everything that they have resources, and that they're getting what they need. And so I think that just problem solving for them and making sure that we can be that resource for them, that partner that is going to be there for them. And also the relationships, right, that we're going to be building. And for me, it's really about building relationships with people that want to improve this and that are going to be partnering up with us to see this flourish and get bigger so that we can impact in a bigger way and help more people. And so I really am looking forward to building those relationships as well with different investors, or what different healthcare people even, right? And I'm hoping that moving forward more, as I continue kind of transitioning out from why I'm doing this and why I started this, we'll be having more guests on and kind of talking about a lot of these different things as well. And so I hope that you enjoyed this episode. Thank you for tuning in again. And I look forward to doing the next episode, and can't wait to hear from you all. Thank you so much for listening to this podcast again, and we'll see you on the next one.
The most fun way to watch us is on YouTube, so be sure to like and subscribe. Also, you can follow me on Instagram, Facebook, LinkedIn, and listen on Apple and Spotify as well. If you would like to learn more about a specific topic, please reach out to us by email. You can find all this information below in the show notes.